Welcome everybody to the talk. My name is Ali. I'm a physiotherapist working at a neuro rehab clinic called NeuroCore. We're located up in Richmond Hill slash Thornhill on 16th and Leslie. I've been working with the neuro population for about 6.5 years, working with TBIs, ABIs, lots of concussions. I often get a lot of questions about cardiovascular exercise. And so I decided to present on that, just making sure everyone can hear me. Yes, Mary, everyone can hear me? Okay. Um, and last time I did this presentation for Bayar, I had a question on cardiovascular exercise again. And so I thought it might be a good opportunity to focus in on just this single topic and really hone in on sort of some of the benefits of cardiovascular exercise on brain injuries and how it ties in with brain injury management. Feel free to ask me questions at any point. I'm going to try and go through the presentation slowly, although there is quite a bit of content. But stop me anytime if you have any questions at all. So we'll get started. Okay, so let me just close this a little bit. So the presentation is going to aim to explore this really cool and fascinating link between cardiovascular exercise and what that means for recovery post brain injuries. Um, and so, as we know, sort of the lifeline of the brain is blood flow and circulation. So, it's a really critical part of brain function that we have good circulation in the brain. Along with circulation, you get lots of oxygen and nutrients that come into the brain, which are really key for good brain health. When you have a brain injury, though, some of that uh, flow to the brain gets reduced, and it's called reduced cerebral blood flow. And that causes less oxygen reaching the brain, less nutrients reaching the brain. So, part of the role of cardiovascular exercise is to really help to stimulate more blood getting to areas of the brain. And as you get more blood flow to the parts of the brain, you can really help improve the delivery of oxygen and nutrients, as well as antioxidants. And these can really help in supporting the healing and reduce inflammation in areas of the brain that are damaged. So, blood flow is one of the key areas why participating in cardiovascular exercise is so important. Let's move on. Now, you guys have probably all heard about neuroplasticity. Uh, What is neuroplasticity exactly? It's sort of the really amazing ability for the brain to reorganize and adapt in response to an injury or in response to learning something or response to a new experience. So the brain is very plastic and we can change the brain over time. Um, Neuroplasticity is really an important part of recovery post brain injury. So it allows our brain to compensate for areas that are damaged as a result of brain injury. So neuroplasticity will help to rewire or recruit healthy neurons to the damaged areas, and that can be really good for functional impairments. So often people with brain injuries have some functional limitations as a result of some of these neurons and some of these wires that are losing their connection. And so neuroplasticity is a really key area of how the brain recovers. So regular cardiovascular exercise can actually really enhance some of the connections between the neurons, and it can help to foster better and more efficient communication between these neurons. And so cardiovascular exercise plays a really important role in neuroplasticity. So we have blood flow, we have neuroplasticity, and then we also have this neurogenesis. Now, what exactly is neurogenesis? We know what plasticity is, but what's genesis? And genesis is actually the formation of new neurons. and new brain cells. The brain is actually capable of creating new neurons to help in recovery. So there's a lot of new research that's coming out that's saying that brain injuries can lead to neurogenesis, and neurogenesis can be affected in parts of the brain that are impacted as a result of brain injuries. And cardiovascular exercise acts as a catalyst for neurogenesis, so it can speed up the process of neurogenesis. The other thing is that exercise can promote the release of neurotropic factors and growth hormones, and these can really encourage the growth of new neurons as well. Remember, the new neurons are all neurogenesis. So, when we have more growth hormones and more neurotropic factors, that can result in accelerated neurogenesis. So we can see that that cardiovascular exercise is quite a bit of improvement in neuroplasticity as well as neurogenesis. And neurogenesis is neuroplasticity. Building new neurons is supporting neuroplasticity. So it really does help to adapt and rewire the brain more effectively, which can really accelerate healing times. The other thing that cardiovascular exercise does is it has this neuroprotective effect. So it helps to really protect the brain tissue, and it helps to minimize brain damage to the brain tissue. So essentially, what we find is during the acute phase of brain injury, the brain is actually susceptible to more damage. And cardiovascular exercise can help it to protect the brain from that further damage. So when you participate in regular cardiovascular exercise, you'll end up triggering neurotropic factors. You'll end up releasing antioxidants in your brain, and these can really help to support the brain tissue and prevent it from further damage. Helping to reduce inflammation and helping to reduce oxidative stress, that can also have a protective effect on the brain as well. So what we see is we have an increase in neuroplasticity and neurogenesis, but then cardiovascular exercise can also help protect those new neurons that are being developed, and it can help protect some of that new connections that the brain is making as well. So it has a host of benefits when we participate in cardiovascular exercise. And remember, it all comes back down to increasing the blood flow and the circulation to the brain. Now, let's talk about the cognitive piece. And I see it in the clinic all the time that people post TBI or ABI have a lot of challenges to the brain, such as memory loss, attention problems, taking longer to think, reducing like the speed at which you process information. So the cognitive rejuvenation part is restoring and enhancing our cognitive ability after suffering from a brain injury. And so what the research finds is that cardiovascular exercise can have a really positive impact on the cognition, on our cognition. And research also finds that participating in cardiovascular exercise, regular cardiovascular exercise, can help people improve their attention, their memory, and a lot of these executive functions as well. And we'll talk about executive functions in the next slide as well. So, but what we do find is there's quite a lot of improvements in your cognitive ability by participating in cardiovascular exercise. And the reason why we see those improvements is again, the result of neurogenesis, neuroprotection, neuroplasticity, and then that increase in blood flow to the brain. So let's discuss sort of these executive functions, and some of these might seem familiar. Um, Executive functioning skills are skills like planning, organizing, having a sense of self-control, initiating tasks, time management, metacognition, memory, attention, flexibility, and perseverance. These are sort of some of our executive functioning skills. And so these are all impacted when somebody suffers from a brain injury. And how does that look when somebody does have some executive dysfunction? So it might end up being like focusing too much on just one thing, being tunnel visioned, being distracted very easily, spacing out or daydreaming, struggling to switch between certain tasks, problems with impulse and control, and then trouble starting tasks or having difficulty starting tasks. And so this isn't necessarily just specific to people who have brain injuries, but if you look at the population at large, a lot of people, myself included, have some executive dysfunction. For example, I might have difficulty focusing too much on one particular thing. So cardiovascular exercise can be beneficial for all populations, regardless of whether or not they have a brain injury, because it can really help with these executive functioning skills. Let's go back to that cognitive rejuvenation, just finish that slide. So like we said, cardiovascular exercise promotes neuroplasticity. It helps the brain to rewire and adapt itself, which is really important for cognitive improvements. We see a lot of changes in the chemistry of the brain, and neurotransmitters such as dopamine and serotonin can really help to improve mood and cognition as well. So, just participating in exercise can really have a really positive impact just by the release of all of these neurochemicals. Neurotropic factors such as this brain-derived neurotropic factor increase during exercise, and this can really help to support the neurons of the brain, and it can help to grow those neurons, and it can help to improve the cognition and the cognitive recovery as well. Hopefully that all makes sense. Does anybody have any questions at all? So far, so good. Feel free to, stop me at any time if I'm moving too quick. Let me close that a little bit. Now, I know this slide looks heavy, but we'll go through it nice and slow. So there is obviously, as you would all know, there's a huge psychological impact as well after a brain injury. And it's very important to address the psychological impact. And there are professionals that, work, psychologists and psychiatrists that work specifically on this. But I want to sort of touch in on the role of cardiovascular exercise and just exercise in general on the psychology of individuals post brain injury. So some of the challenges that people often experience with brain injuries are, feeling depression, increased anxiety, mood swings, feeling frustrated. I see this in the clinic all the time. And cardiovascular exercise really has a positive impact on mood. And research shows that participating in exercise regularly can have a reduction in symptoms of anxiety, stress, depression, particularly for survivors of brain injury. Again, going back, cardiovascular exercise helps to release endorphins, serotonin, dopamine, which are really good for elevating your mood naturally. Let's see. The other part is just improving your self-confidence and self-esteem. And so that is a major part in how we view ourselves, and participating in cardiovascular exercise can really have a positive impact on self-esteem and self-confidence. Group exercises are really good for that because we can participate in exercise with others and this can help improve our social interaction and support from other individuals as well. So it can reduce the feeling of being isolated and alone by helping to participate in a group and or a community setting. The other part, which I think is really, really important, is it can help improve your sleep quality. Which, if I ask individuals in the clinic, how's your sleep? 9 times out of 10, it's disturbed. People either don't sleep enough, or they sleep too much, or they take naps during the day, or their sleep is very irregular, can't fall asleep, wakes up at 5 a.m., can't go back to bed. So cardiovascular exercise can really help improve your sleep quality as well, which, if you have better sleep, your emotional state of mind is going to improve, and overall mental health gets better as well. Okay. Technology. I love technology, and I'm a huge proponent of using some technologies to help to participate in cardiovascular exercise. So research actually shows that using technology such as a Fitbit or a smartwatch or iPhones or whatever it may be can really help to motivate and engage people to stick to their exercise plan and keep them accountable. So the other thing that it really does well is it gives you real-time data based on your heart rate, your oxygen saturations, how intense the exercise is, how many steps did you take, how many calories did you burn. So you can really get a lot of this data right away when you're using technology such as a smartwatch or a phone. And so this can be a really big motivating factor in terms of setting your goals and reaching your goals. These devices also, you can set timers and reminders and say, okay, it's time to exercise now. 20 minutes of cardiovascular exercise coming up. So this can really help to boost your mood and your motivation, as well as keeping you accountable to stick to the exercise program. So you can also use this data to share back with your healthcare provider. So if you're seeing your doctor or your physiotherapist or anybody, you can use this information and you can bring it back. I've had people come to the clinic and show me their smartphone and say, oh, my iPhone has been tracking my heart rate and my sleep, and this is what it looks like. And me as a healthcare provider can take that information and identify areas of problems and areas that need to be improved. And we can come up with strategies to help progress the exercise programs as well. And one more thing that these devices can be really good at is to keep you within a safe limit of exercise. So if we determine that a safe limit of exercise is a heart rate of 100 beats per minute, for example, if you're exercising too hard, that device can pick that information up and say, I think you're exercising too hard, maybe time to slow it down a little bit. Or if you're not exercising hard enough, it can encourage you to go a little bit faster. So there's a lot of good reasons why technology can be a huge asset when you're trying to stick to an exercise program or doing cardiovascular exercise. So what are some of the do's and don'ts of exercise? Let's talk about the do's first. Always consult with a healthcare professional like a physio or your family doctor when you start an exercise program. The exercise programs should be individualized, so specific to you, based on your fitness levels, based on your goals. So speak to your family doctor or physiotherapist to help you individualize that plan. Always start slow and progress gradually. Keep an eye on your symptoms and evaluate how you're feeling. Am I feeling too dizzy? Am I getting nauseous when I'm exercising? Do I feel lightheaded, or are my headaches getting worse? Those are things to look out for when you're participating in an exercise program, and then communicating that back with your healthcare professional to see if you can monitor that. Always do a warm up and a cool down. And that's always a good idea to do, and that'll help avoid any other injuries. So, torn ligaments, sprained muscles, all of that stuff can happen if you're not warmed up enough. And then just balance the intensity of the exercise. What we find that a moderate intensity generally is good for most people. And finally, stay hydrated and eat well. You can exercise all you want, but if you're not hydrated and you're not eating well, that can take a big toll on your body, especially when you participate in an exercise program. I always recommend, speak to a nutritionist or a dietitian, at least just getting a baseline information for what is good healthy food and what isn't based on your goals. Some of the don'ts of exercise is don't overexert, don't skip the cool down or the warm ups, avoid high impact activities, avoid overheating. So it's always a good idea to exercise in a space that's air conditioned, for example, in the summertime. Don't push through the pain. A lot of traditional or conventional exercise programs will say, "Oh, no pain, no gain." But it's not necessarily applicable to population if you've had a brain injury. So don't push through the pain. If headaches are worsening or if you start to experience neck pain, it's not a good idea to continue. And it's probably a better idea to stop, reassess, maybe speak to your physiotherapist or your doctor, and then reevaluate that program. Or just don't do the exercise that causes you more pain. Avoid excessive noise or distractions or exercising in spaces that are really like overwhelming. And don't neglect the rest and the recovery. So, you do sometimes see people exercising 7 days a week. Probably not a good idea. It's always a good idea 3-4 days, up to 5, and then getting a few days rest and recovery. That's very important. And avoid really intense exercise closer to bedtime because it may have an impact on how well you sleep that night, and then that's going to have an impact on how you perform the next day. Okay, so those are just some do's and don'ts. Now, let's move on slowly. Here's a sample exercise prescription. So it's just an example. Everybody is, like I said, is going to be individualized for everybody, but this is just a sample. So if I had a 40-year-old male presenting with a mild traumatic brain injury, here's kind of what I would recommend. And I would obviously first do a thorough assessment of their physical health. I might even get them to do a stress test, like a treadmill test or a bike test. But generally, I would recommend they exercise 3 to 5 days a week of cardiovascular exercise. The intensity of that exercise would be low intensity. And by low intensity, I mean less than 60% of your heart rate maximum. And typically, your heart rate maximum is calculated based on your age. So a 20-year-old's heart rate maximum is going to be very different from a 70-year-old's heart rate maximum. So based on his age, he's 40 years old. I would recommend a heart rate of about 110 beats per minute if he's able to tolerate that. So 110 beats per minute would be a good place to start. And I would recommend about 15 to 20 minutes of continuous exercise. Now, remember, you're also going to do 5 minutes of warm up and a 5 minute of a cool down. So, that 15, 20 minutes is going to look closer to 30 minutes. If you have any questions about the beats per minute, feel free to ask, even closer towards the end if you'd like. But generally, we calculate your beats per minute based on your age. And easy thing to remember is if you're exercising and you're tracking your heart rate and you're starting to be symptomatic, you feel nauseous or you feel your head's hurting, just drop the intensity. That's the best thing to do. The type of exercises I'd recommend would be like low intensity, like walking or a stationary bike or a treadmill or an elliptical, something that's kind of continuous and it can challenge your heart rate. Some people like to go for a swim. Some people like to do higher intensity, like burpees and lunges and stuff like that. That's all good. It really, again, depends on your fitness levels But a good place to start would be like a stationary bike. And how do we progress this exercise program? So what we end up doing is every couple of weeks, we would try and increase the heart rate by 5 beats per minute. So if this individual is at 110, then in about 2 weeks, I'm going to say, let's try 115 and see how you do. So that's one way. Or another way is let's try and increase your duration. So rather than exercising for 20 minutes, we're going to try for 25 minutes this time. And you can always track all of these data points with wearable technology, like we discussed earlier, like a smartwatch or a Fitbit. Okay. And finally, one of my last slides here is it's just a matter of taking action. So hopefully some of the information that I gave today can really help motivate you and inspire you that, you know what, participating in cardiovascular exercise or any type of exercise program can really help improve your symptoms post-brain injury. So, you know, unlocking your potential, tap into your inner power and embrace the journey through exercise. Exercises, you can't go wrong with it. It's always going to be beneficial. So if you haven't started, it's never too late. Build momentum. Once you start, it's very easy to continue. The hardest thing is getting started. Even for me, if I'm not going to the gym for 2 or 3 weeks, it's really hard to start again. But once you start that first day, I could be in there for maybe 20 or 30 minutes, but then the second day becomes a lot easier, and the third day even easier than that. Regain your independence. So cardiovascular exercise can really enhance your physical health. It can enhance your cognitive health and your mental health. So that's going to give you a lot of independence back. It's going to really help to boost your confidence. Achieving your fitness goals is amazing. It's an amazing feeling. And it's an amazing feeling to have good self-esteem and good confidence, and exercise can give you that. Remember, every step counts. Every workout is important. So no matter how small it is, even if you just go and say, I'm going to just sit on the bike and pedal for 10 minutes today, that counts. Okay. So you don't have to commit to an hour-long program every day. Even 10 minutes a day is enough. Stay focused on your goals and set realistic goals. So, you know, if you're going to say, I'm going to do 10 minutes for the next week, and then the following week, I'm going to do 15 minutes, that's a realistic goal. That's achievable. And so, you know, set small goals, and that's really going to help push you to the end. And really believe in yourself, and that, you know, individuals with brain injuries can make a remarkable recovery, can have massive transformations. And it all really starts with starting today and starting small. And, you know, start today. It's never too late. It's always a good idea to begin your first workout, see how you feel, and then build from there. Okay. This is just a reference list. I've got tons of references if you guys need, but small reference list. And that's it. That's all for today. I'm all done. So if you have any questions at all, please feel free to ask.